Hi everyone, my name is Laura Carvajal and I will be presenting in my career path about how to become a psychiatrist. Some of the requirements that I need is I need to go to medical school, where I can either choose to become a medical doctor or the path that I'm going to follow, which is becoming a doctor of osteopathic medicine. You can look more into this, which is something very, very interesting. But it's basically medicine that is centered in a more holistic point of view. And I will be talking about this more in the presentation so you can know a little bit more about it. But other requirements that are needed are to take the MCAT test, which is the test that you need for medical school. You need your resident state license and you need board certifications. The projected job growth is 14%. And median salary can increase depending on your qualifications. After you're done with medical school, you need to have clinical residency, which is 4 years. Salaries, it's paid residence. Other requirements is to attend lectures and seminars in order to keep abreast of advancements in the field. On your second year, you're introduced practice in psychotherapy with actual patients, under the supervision of a licensed psychiatrist, of course. And on the third year, you're focused on specific topics such as child adolescence or geriatric psychiatry. And in your fourth year, you're devoted to developing additional areas of professional interest. So this is more centered in whatever your interests are. On your 4th year, you will be seeing this. Some of the key responsibilities of a psychiatrist is to diagnose or evaluate mental and emotional disorders. Something that is less likely to do, but you can also do, is observational interviews and psychological tests. And you formulate and administer programs of treatment. And compared to other areas of psychology, you have access to prescription of drugs to people that have severe addiction problems, or other mental health issues like schizophrenia and so on. And this is where I'm going to talk to you a little bit about more of this holistic psychiatrist. So basically, we will examine a patient's diet, physical condition, emotional health, lifestyle, and mental health before recommending a treatment plan. So it's a whole picture. We see people more as individuals instead of a normal patient. Education. For undergrad classes, you need to consider these classes. Personal psychology, abnormal psychology, all of these ones are important for your undergrad classes. And I'm also going to go to pre-med programs where they show you what classes you need to use for medical school. And it's just basically biology. This is for BYUI. Physics, mathematics, English, all of these ones are the requirements. Finally, something I want to talk to you is about my career nurturing. Some important things to consider if you want to be a psychiatrist is that you have to have a high GPA. The minimum is 3.0, and depending on how much you want to get into medical school, you just go above 3.0. So 4 would be amazing, right? And you also need to be involved with extracurricular activities like service, anything that can add up to your application. I'm also going to prepare for MCAT tests and GRE. Because my plan B, if I don't get to grad school, I'm going to need a plan B or even a plan C if these two don't work. But my final goal is still going to psychiatrist. But I can have a PhD or a master's before I do my med, which is also recommended to do. So these are things to consider if you don't get a medical school. Yeah. Bye. some of my greatest insights that I got from chapter 13 is on this quote. My job gives my life meaning and direction. And this is why I decided to do psychology, because it gives my life meaning and direction. I have a strong interest in human behavior. Why do we act this way? Why do we interact this way? How can we do better interactions? How can I help people that struggle with this? And in order to do that, to help other people, I want to figure out myself. I want to figure out how can I improve my personal skills, and how can I improve my social skills, and just become a better person so I can help other people in this area. I've always been intrigued by our mental processes, and I've always been intrigued about how to help others better. Yeah, so this is the reason why I decided to do psychology. I major in psychology, and I want to become a psychiatrist because I'm very interested in doing and finding out more about this holistic medicine, and I think it's going to be something very amazing, and I'm very excited to do it. So I hope you like this presentation, and I'll see you guys soon. Bye!